Hello, everyone, and thank you for joining us for the Fertility to Perimenopause and Beyond panel. We wanted to make sure that we had content that wasn't just for mothers of young children, because we know that we're women and our bodies change and do weird things on us all the time. I just turned 40 this year, and already I'm like, why am I doing weird things? Thank you. It's a milestone. So I wanted to set a quick expectation for this panel. We are going to have three amazing women who bring so much experience and clinical information to their practice. And I definitely think this is probably my favorite panel, just probably because it applies so much to myself as well. Our goal is to leave you feeling more informed and with tools for your future, because if you're like me and you talk to one of them and you find out, oh, I actually do have problems that I need to deal with and I didn't even know it. So first, we're going to welcome to the stage Dr. Jenny Mercier. So Dr. Jenny Mercier is a naturopathic doctor, PhD, an internationally recognized women's health expert, midwife scientist, and the founder of the Mercier Therapy, a pioneering pelvic organ mobility modality that has transformed fertility and pelvic pain care worldwide. And she also has some really exciting news to share that I will let her open with. You take it off? Yeah. No, we'll leave it. That's fine. Okay. We'll be noisy. Okay.
Hi, everybody. Thanks for coming, and thanks for coming to hear me talk. My brand new film, Conceiving Miracles, it's my second documentary, will premiere at the Arcada Theater downtown St. Charles on May 23rd. I'm going to show you the trailer. I just got the trailer. Thank you so much. The film turned out amazing, and I'd love to have you all there if it's on your heart to do so. At my table, there's a QR code where you can just run your phone over it and get the link to buy a ticket. And if you buy a ticket, you get an Expect a Miracle mug. The mug, it's really cute, and it's got my logo on it, and so you get one of those if you buy a ticket to the film. We're going to cue up the trailer, and so you can have a sneak peek.
Motherhood is creation itself. The body of woman attuned to the music of life.
We were trying to get pregnant for about 3 years.
Tried for about a year,
Trying to get pregnant for 4 years.
of all human ones, none is stronger than a yearning for a child.
You feel hopeless while your significant other person with all the stress and pressure you put on yourself.
You use your whole self. And how do you want to feel before together?
When I started my fertility journey, I had so many questions. I was told about her from a midwife. I joined Mercy, started this thing called Mercy, and I had to teach how women conceive naturally.
I felt heard, I felt seen.
If nobody else understands.
I had so much hope.
Give us a picture from you.
That's just a little sneak peek. The whole movie is really good. It turned out so amazing. Just a quick word of prayer here before I get started, because I wouldn't be here without Heavenly Father. So I want to say thank you to Heavenly Father for allowing me to be here, for bringing all of you amazing ladies here to this room today, and for allowing us to just be sharing information and aligning and just really living in His way of life and how we do things, from the way that we conceive, the way that we give birth, the way that we feed and nourish our children, the way that we school them, and beyond. So thank you for that. Mercier Therapy was born out of the need for my own health. I was diagnosed with stage 4 endometriosis when I was very young, and 26, and it was terrible. I was a midwife back then. I'm a midwife. Once a midwife, always a midwife. That never leaves you. I could catch a baby tomorrow, no problem. But my baby Claire, she's 14. I haven't delivered a baby since she was born, and the last baby that I delivered, I did the postpartum visit the next day and brought my daughter, who was 3 months old, and laid her on the bed next to the new baby, and I felt like, oh wow, this is true community midwifery when we've got this going on and we're parenting and we're, nursing our babies and just doing all the good stuff to fortify our experience as parents. So anyway, I just want to say Mercier therapy has been a giant help for me personally, given the fact that I have stage 4 endometriosis and Hashimoto's thyroid disease. But I was told after my 3rd laparoscopy to clean up all this aggressive disease process that I would have to have IVF. There was a friend of mine, Dr. Charles Miller, who practices in Naperville. He said, it looks really bad in there. You're going to have to come see me for IVF. And going backward to when I was a clinician in that industry and I monitored all the IVF cycles start to finish, I did all the IUIs, all the inseminations, which is an IUI, semen analysis, pap smears, endometrial biopsies, all of the labs and the ultrasounds in that world. I knew that was making babies by force. And there are times and places for IVF, for true medically indicated cases. I could have fallen easily into that category, but my tubes were open. My tubes are open, which is a great thing because with endometriosis, sometimes it can sit inside the tube and scar the tube. But my tubes were open, and I said, by golly, I'm going to figure it out, and I'm going to get pregnant on my own. And my students worked on me, and I got pregnant the next cycle. And can I just tell you that was in my 2nd marriage. I was married before. I never had a pregnancy. And so I was 35. I lost that pregnancy. I lost the 2nd pregnancy. 3rd pregnancy was my daughter. I had pregnancy, lost. The 7th pregnancy was my son. So I've walked through the mud to get to the grass. It was really, really challenging. All those pregnancies had heartbeats. But here's the real reason I created Mercier therapy. It's a sequence. It's a deep pelvic organ visceral manipulation sequence. We work through the abdomen. There's nothing invasive, no vaginal work. Time and place for that. But I work through the abdomen. I mobilize organs and I restore blood flow to the pelvis. When you do that, it's like flipping on a light switch that's been off for a long time. I'm helping to manage pain. I'm helping to manage better cognition from the hypothalamus and pituitary gland down to the ovaries. I'm helping signal, make estrogen. It's a very sharp signal. It's a very direct signal. Most women who have trouble pathology here, PCOS, endometriosis, past surgeries, C-sections, situations, polyps, dermoids, fibroids, that's all impeding upon natural health in the pelvis. So I go in and I work on those things, and I'll be very honest when someone needs the intervention of a gynecologic surgeon. I have the right people to send women to at the right time. I'm not against medicine. It's there for when we need it. But I also know that probably 70 or 80% of the time we don't need it. And we can heal without cutting and drugging and forcing the body to do something that it doesn't want to do. I think you might agree with me there. So let me just say this in closing, because I love fertility and it's my heart, and I consider myself a fertility expert at this point because I speak the language of medical fertility, and I also speak the language of integrative or natural conception. There are 1.2 frozen embryos in this country right now, and those are all human beings. Only 8% of those will actually end in a live birth. That's a lot of babies that are being discarded or being donated for stem cell research. Think about it. I'll close with this. I know I said I'd close with that. But IVF is the biggest, boldest, brightest thing right now when it comes to fertility, and every woman that comes in my office has either gone through fertility cycles with a medically indicated purpose and has failed IVF, or has conceived with IVF and then lost the pregnancy and then goes back in for more frozen embryo transfers and fails and fails and fails and fails. There's a reason for that, and we have to look at that reason. But moreover, This is a very expensive industry. It's an industry put in place to make a lot of revenue. This is a $30 billion industry where we're hyping women up and making estrogen levels higher than they've ever been in a natural cycle. When you do that time after time, you're putting ovarian and breast tissue at great distress. If we need IVF, we should minimize it to one cycle, one retrieval, and then transfer the embryos as we need them. This industry is there to not only help the women and couples that need it, but to make a lot of money. You should know that. Medicine in general is there to make money. They're not really there for us, you guys. I've worked in this a long time. I speak that language, all the language of medicine, and they're not, even friends of mine that are MDs, they don't align with the current value of big managed medicine anymore. So keep that in mind if you think that you need IVF. Keep that in mind. Come see me first. I'll talk you through it. I'll be your liaison. I'll help you discern what you do and don't need. That's what I got for you. I hope that's helpful.
Thank you, and I'm sure you'll get lots of questions. So now we're going to welcome to the stage Jana Richardson. And Dr. Jana is a board-certified pelvic floor physical therapist and the owner of Chicago Pelvic Health. She specializes in pregnancy and postpartum care, including pelvic floor and core rehab for women through pregnancy, postpartum, and beyond. And she's the one that made me realize I have problems. Do you want to walk around, or do you want it here?
I'll probably be right here.
Okay.
All right. Thank you all for being here. I'm going to be talking about a topic that I feel like we don't hear enough about. We're definitely getting better, but there's still a lot of work to be done here. So I'm going to talk about what the pelvic floor is, the changes that happen through pregnancy, postpartum, and then beyond that as well, and practical tips that you can hopefully take home today. So first, I want to talk a little bit more about some things that we're told as moms or as women that's maybe just part of what it is now and how our lives are going to change and move forward after being a mom. Things like if you pee a little bit when you sneeze, that's normal and that's totally fine after having kids as long as you aren't doing this all the time. Every now and then is okay. Or if you have back pain, that makes sense because you're carrying a lot of things. You're carrying a stroller or carrier, your heavy 40-pound child. It makes sense, no wonder you have back pain. That's a little bit what it should be like. Or if you have prolapse, just don't lift anything heavy, just kind of quit doing your gym workouts and maybe do a little bit more like light weights. And one of my favorites, if you have painful sex, just have a glass of wine or use more lube. These are things that a lot of my patients are being told, and we're told so much of this that we're almost thought to think this is good, helpful information, or okay, I guess this is just like how life is now after having kids. And these are really signs that our pelvic floor is asking for help. And there's lots of things we can do to prevent these issues and even help it, even if you've been experiencing these symptoms for 10 plus years. So I'm gonna dive into first what the pelvic floor is so we have all of a good knowledge on what that is. So you can see from these pictures here, the top one is like a top-down view of what our pelvic floor is, and then the other one is a side profile. So let me grab my model. I can't leave without showing you guys this. So if we look at it three-dimensionally, you can see this is our pubic bone in the front, our hips, and then our back here, and our tailbone. So our pelvic floor muscles not only are just our vaginal muscles. A lot of people just think like, okay, just squeeze the vaginal area, but really there's so much more to it. There's the rectal canal. If we take it apart here, we can even see that there's deeper layers, and those are the layers that help to lift and support our core. If you look at this view, you can even see how a lot of these muscles are actually part of our hips. So when we consider the pelvic floor and look at it, we really need to be looking at the entire body, meaning your hips or your knees or your feet and ankles, even to your neck, because our nervous system is so tied to our pelvic floor as well. So it really needs to be a full body system working together. So what do these muscles do? They function basically all day long without us even knowing it. And one of the first functions, as we probably could all predict, is our bathroom health. So essentially, these muscles, they help us control when we want to go to the bathroom for both peeing and pooping, and then also help control it when we're doing activities throughout our day. Sexual health, so it helps with sexual appreciation. It also helps with any sort of like menstrual care, so insertional care. And then pelvic support. So it helps to support our bladder, our uterus in the middle, and then rectum in the back, which also leads into our posture. So as I said before, our pelvic floor is part of our deep core system, part of our hip stabilization.
Yeah, we have a power issue back here. Sorry, 1 second. Try.
Oh, there we go.
Sorry.
Okay, we're back. So yeah, those are the 4 functions of what our muscles do all day long without us even knowing it. So this is a great depiction, so you can actually see how our pelvic floor moves in action. So our diaphragm is a top muscle underneath our ribcage, shaped like a dome, and it mirror images our pelvic floor. So diaphragm helps us breathe, help with core support, and then our pelvic floor does the opposite end here. And they work like a piston in a canister. So they move up when we take a breath out, and in when we move, and moves down when we take a breath in. And it essentially works like a trampoline. So when it kind of shock absorbs. So every time our foot hits the ground, or every breath we take, or even lifting our arm up, what it does is it should bounce down and back up. And when it does that in a nice position, then all of those bowel, bladder, sexual health functions, they all work well. So this is a great part of our hips. You can see how it changes throughout pregnancy. So first trimester, typically early on, everything is still nice and stacked. They're one on top of the other, so they work in that nice trampoline system well. And then once we get to the second and third trimester, what happens is they're not necessarily on top of one another. They might be a little bit more skewed this way because our abdominals are a little bit more lengthened, or our back muscles are a little bit tight. So that's how it shifts during pregnancy. However, a lot of times we still kind of assume this posture postpartum or even years down the road, because maybe we haven't really gotten our lower abs to kick back on, or maybe our posture is really forward slouched because we're doing a lot of forward movements in life. So just because this is kind of what we see during pregnancy, I often see this postpartum and years down the road, just because our lower abdominals and our glute muscles don't always turn back on like they should. So this is why moms are even at risk years down the road. So one of the factors are hormonal shifts. So our hormones, it's pretty obviously change a lot during pregnancy and postpartum, and then years down the road when we all become perimenopausal and menopausal, we have similar changes within our pelvic floor, and that really changes how it functions. For example, starting at the age of 35, we actually start to lose 2% of our urethral striated muscle tissue and bulk every single year, and that starts really early. So it's not just a wait and see and we'll work on these issues later, but they start really early on. And postpartum, at least pelvic floor wise and vaginal tissue wise, looks very similar to perimenopausal. Another risk, again, is those posture changes, not getting those core muscles to kick back on. We might have scar tissue, whether it's a C-section scar or perineal scar. Scars don't move that well, and if we're not mobilizing it specifically in those areas, then it stays stuck that way, and then other structures have to compensate. Diastasis recti, so that's the abdominal separation of those muscles. Again, if we're not strengthening specifically to get into those deep lower abdominal muscles, stays there. And then again, glute and core weakness. If we're not strengthening the back end or turning those back on postpartum, then we assume that, once again, unstacked posture. And then I think the biggest one here is a lot of people end up adjusting or avoiding exercises because of possibly symptoms that they developed during pregnancy or postpartum, like prolapse, pelvic heaviness, leaking. And when we adjust those things and we're not doing the activities or exercises that we love to do or used to do, then our activity level overall reduces, our muscle mass reduces, not only in our pelvic floor, but our hips, and then it just creates this cascade effect. So these are things that I just want you to remember or hopefully keep in mind of if you have any pelvic floor issues. These are the signs and symptoms that you could get help for. So the first one is if you have obviously any peeing or pooping issues. So if you're getting up in the middle of the night and you're not over the age of 65 or pregnant, that's a sign. If you feel like you have to know where every single bathroom is every time you get to a new place, that's a sign. If you feel like you have a UTI or something like that and it's not actually positive, a lot of times it can be your pelvic floor. Or if you're having any constipation issues, incomplete emptying, that sort from the other end. So the second P is prolapse. So that's essentially where these pelvic organs have a little bit more wiggle room and then create symptoms like pelvic heaviness, a feeling of falling out vaginally or rectally, a feeling of a tampon being misplaced internally. Those are all signs of prolapse. Pain is never normal for anybody, but especially pelvic pain. So if you're having any pain with pelvic exams, intercourse, pain with exercise, pain with movement, those are signs. And then lastly, if you feel like you've had this like abdominal pooch that has never gone away and you've done every single core exercise you could think of, oftentimes it could be your pelvic floor influencing how your lower abdominals kick on. So my top 5 pelvic floor tip takeaways are Kegels aren't always the answer. I think a lot of people know Kegels and that's all they can do for their pelvic floor, but there's a lot more than just squeezing and contracting. We actually need really good length in our pelvic floor for it to contract well. Similar to a rubber band, you need to stretch it for it to come back. Avoiding constipation is a huge one, and that's not managing it with like Miralax or things like that. I'm talking about getting good abdominal movement, getting good bowel regularity habits naturally, teaching those muscles to relax, because if our bowels are being backed up, and that's in the back here, our bladder is in front, and that's going to start to push on the bladder and create possibly frequency, urgency, leaking issues. Third one is don't pee just in case, or try not to hover over a toilet if you can, because then you're training your bladder incorrectly. So when we pee just in case, we teach our bladder to empty when it's maybe halfway full. And if we do that regularly, or even teach our kids to do that regularly, we can perpetuate a habit of hypersensitivity in our bladder. And then it makes us feel like, oh my gosh, my bladder is just really small and that's why I have to pee all the time. But really, it's just a training dysfunction there. Hovering over the toilet, that just contracts your pelvic floor a little bit, and we need our pelvic floor to fully relax for our bladder to fully empty. Fourth one is, hopefully you saw from those videos, that our diaphragm and our pelvic floor need to work together. So again, breath work is the foundation for all of pelvic floor training. So if you do anything for your pelvic floor, I would say it's learning how to do diaphragmatic breathing and getting your abdominal wall and your rib cage to move well in order for our pelvic floor to move well. And then lastly, strengthen our entire body, especially your glutes and core. Pelvic floor, once again, doesn't work in isolation. We need to work it together with our hips, our low back, our abdominals, sometimes even down to our feet. So think full body when we're thinking pelvic floor and not just Kegels. And that's all I got. So if you want to follow me, I try to put free tips on some of my Instagram and things like that. So I hope you learned something today.
Thank you so much, Jana. Like I said, you're going to learn a lot from her. She has a lot of information to share. And I also would like now to welcome to the floor Katie McMenigal. She is a board-certified family nurse practitioner and leading voice in functional and regenerative medicine. As co-founder and medical director of Peak Health Institute, she specializes in chronic multi-system illnesses. Her expertise is grounded in a near career as a NICU RN at Lurie Children's Hospital, where she developed a strong foundation in managing high acuity symptoms. And I really enjoyed getting to know her and her expertise, and I think you guys are really going to have a lot to learn. So, welcome.
Hi, guys. So yes, I'm Katie McManigal. I founded Peak Health Institute 5 years ago, and we are located in Warrenville. Most people ask where that is. It's right between Wheaton and Naperville. I always say we meet the patient where they are. Good? Okay. We meet the patient where they are and we take them where they want to be. So we do see a lot of patients who have mold illness, Lyme disease, autoimmune disease. We treat the gut, we open the detox pathways. And once we do those things, we get to the place of how do we optimize. And when we get to the place of optimizing, we get to get into the fun things like regenerative medicine, mitochondrial healing, and hormone therapy. Probably most people don't think of hormone therapy as fun, but I do. So I'm sure many of you can relate to having had some symptom in your life and being told that your symptom is normal. You're a mom, it's normal. You're tired, it's stress, maybe it's anxiety, it's normal. You know, go on your way, deal with it, or maybe you're offered some kind of medication to take the symptom away. That's going to give you 15 other symptoms. It's important to remember that common does not mean normal. So just because everybody in our society is experiencing these symptoms does not mean it's what our bodies are meant to experience. Now, some of you may have played this really fun game that a lot of my patients have played. The game is, am I tired, mom, exhausted, sleep deprived, or am I in perimenopause? It's a very common question, and sometimes people fluctuate between that day to day, like, okay, maybe I'm just exhausted. Moms are having babies typically later in life than previous generations, and so sometimes those lines do get blurry between, is this left over from me having babies and I'm just not sleeping and replenishing, or am I getting to the point where I'm getting into perimenopause and I need to start looking at how to manage that? Now, immediately postpartum, women have, like 90% drop in their estrogen and progesterone, the prolactin levels increase, your cortisol increases because you're sleep deprived and you're stressed out trying to take care of this little baby and keep them alive. And so those changes are kind of like expected, right? We know that our hormones are going to dip. We know it's going to be a bit of a roller coaster. But babies don't all, you might look online and find like, oh, your baby should sleep through the night by the time they're 3 months old. And then you become a mom and you realize that that's very silly information. And so most of us are sleep deprived through the toddler years and beyond. And we're not putting ourselves first because kids take a lot of effort and energy. And so we may not be replenishing our nutrients the way we should. We may not be managing our stress the way we should. And it turns into this blurred line of like, okay, I'm 2, 3, 4, 6, 10 years out. Postpartum depletion can last up to 10 years in women. And so if you have a kid in your 30s, that's going to seep right into those years that you may be starting to cross into perimenopause. Oftentimes, perimenopause symptoms are more so a gradual thing. You may not notice it right away, though, because you live in your body every day. So you're a little more tired. You're a little more moody. But the biggest things that I see when perimenopause starts are you can't sleep through the night. All of a sudden, you're waking up at 3 a.m. and you don't know why, and you can't fall back asleep. and you're more anxious, you're more on edge. Those are the two first things I see, because typically the first hormone to go during perimenopause is progesterone. And progesterone is our happy hormone. It is like nature's Prozac, nature's Xanax. It keeps us calm and relaxed and happy. And so that is typically the first one to dip, and all of a sudden our body is like, I can't sleep and I'm on edge and I'm snapping at everybody. But that can also happen from being depleted postpartum. So it's really important, and I know earlier Jessica made some good points on this, and I have a very similar motto of don't guess, test, because I think if we have those answers of nutrient depletion or hormone imbalance, we can then apply the proper procedures or the proper supplementation or whatever you might need to fix that imbalance. Currently, in our allopathic medical system, most women who seek out care for these symptoms end up on some kind of SSRI, some kind of medication for depression or anxiety. That can happen before pregnancy, during, after. I see a lot of women in menopausal years who end up on these medications, and they do come with a whole list of side effects. For example, if you are on SSRIs in pregnancy, like, yes, it is important for your mood to be stabilized. I just wish that our system had a better approach of looking at mom's nutrients and hormones to do that, and then use medication as a last resort after that, right? Because up to 30% of newborns who are exposed to these medications during pregnancy have a hard time initially bonding. They're more jittery, they're more anxious, they don't feed as well. And that just leads us into a motherhood that is more exhausting and causes more anxiety, and it's just this slippery slope. So test, don't guess is very important. Actually, another thing that Jessica talked on earlier is the importance of the gut and the detox pathways, okay? So in my patients who do start hormone therapy, the ones who thrive on hormones are the people who have done the work on clearing out dysbiosis in the gut, opening up detox pathways, and getting things flowing the way that they're meant to be. Our cells are like really incredible, but when they're gunked up with toxins, what that does is it basically impedes the chemical messages that our cells need to be able to properly create and relay hormones throughout our system. So if you are approaching hormone therapy and you're not seeing the results that you want, you probably need to take a step back, heal your gut, open your detox pathways. And a really interesting thing, so if we look at like pregnancy, nursing moms especially, we're going to see depletion of things like iron, magnesium, vitamin D, B vitamins, zinc, omega-3s. We're not going to see a deficiency in chemical medication in a woman. We're going to see deficiency in nutrients. So if we can replace these nutrients and we can use things, for example, like progesterone therapy, we can actually fix a tremendous amount of the mental health issues that come with hormone dysfunction, anxiety, depression. Studies have shown that 90 to 95% of women who use progesterone for postpartum anxiety, postpartum depression, see a significant improvement. Think about all of the lives that we could change if we just use a little bit of progesterone instead of starting this cascade of medications that have other unwanted side effects. So testing nutrients, testing hormones, seeing where you're at, getting the proper care that you need. So I wanted to kind of keep these slides simple so that you guys have some things that are like take home. Magnesium is incredible for helping our hormonal signaling in the system. Omega-3s, fatty acids, those get so depleted when we're nursing. Fats build a baby's brain, and so that baby is sucking all of your fatty acids right out of you. Replacing those are really important. Vitamin D, vitamin K. Vitamin K is incredible for your bone health, and we know that as estrogen goes away in perimenopause and menopause, that our bones just become brittle and more fragile and more at risk. Osteoporosis is a huge thing post-menopause. So vitamin K, vitamin D are really important for that. A B complex, but making sure that your B vitamins, your B12, and your folate are methylated. 60% of people have a issue with metabolizing B vitamins adequately. So a methylated B vitamin is going to help with the way that your body metabolizes hormones and is able to utilize them on a cellular level. Iron deficiency is a very, very common thing that I see in moms. So without enough iron in our system, our body cannot transport oxygen properly, and our organs and cells cannot work properly if they don't have enough oxygen. Inositol is fantastic in those perimenopause years, or even postpartum, when you are like, my progesterone just can't get back to it because I probably have too much stress. So stress steals the hormone that's needed to make progesterone. And inositol helps to give our body the tools to create more progesterone. So inositol is a really great one for progesterone, especially in perimenopause before you might be ready for hormone therapy. And stress is a huge disruptor of all of those things, the pathways, the inflammation. So the more that we can keep those stress hormones at bay, I always say we can't control what happens to us in life. The one thing we can control is our response to it. Albeit that is very tricky sometimes, especially when we are tired and burned out and exhausted from motherhood. So where to start? If you're not seeing functional medicine is a great place to start because we can look at your gut health, we can look at your detox pathways, and those are so important for hormonal health. But if you are starting with your OBGYN or your PCP, these are the things to request off the bat. You want a full hormone panel, not just one or two hormones. If you're cycling, it needs to be done at the proper time in your cycle, which typically I like to look at those between day like 19 and 21. A full thyroid panel, not just a TSH. A thyroid panel is like 7 markers, not 1 or 2 markers. Micronutrients, so your B vitamins, your vitamin D, your magnesium, your zinc, your copper, your iodine. Cortisol levels. This is best measured through saliva or urine. And then looking at your metabolic health. So what is like your hemoglobin A1C? What does your insulin resistance look like? What does your blood glucose look like? You know, getting a picture of what's going on there is also really important. And a really important thing to remember is that your body is not broken, it's communicating with you. So as women, we need to kind of take things into our own hands and advocate for ourselves because the industry is not set up for us to thrive. So it's really important to advocate for yourself, ask for those lab tests, educate yourselves, and really have a grasp on how to decipher between where you're at and find the right person to help you determine, is this postpartum? Is this perimenopause? Is it a blend of the two? And what are the steps that are going to get me thriving and heading into my next stage of life without bone disease, brain fog, Alzheimer's and dementia, diabetes, heart disease? Hormones and micronutrients can prevent all of those. So it's a lot of information, tried to squeeze into a short time, but I think those are kind of the most important bits to know.
Well, thank you so much to these amazing, such knowledgeable women. I'd love to invite Jenny and Dana back to the stage. You guys find a seat. If you were in the last panel, you know how I do this. So I'm going to walk around the room. If you have a question, please raise your hand, and try to raise your hand before the last question finished so I can walk to you with the microphone. Thank you. We've already got our first question. Please try to direct it to the speaker if you have a question for a specific speaker. If it's to the whole panel, then everybody can answer.
Hi, thank you so much, ladies, for speaking. Katie, my question is for you. So you were talking about just the natural depletions that happen after pregnancy and with nursing and everything like that. What are some of the most practical things that you would recommend as far as replenishing? Because, there is that depletion of nutrients and everything.
Yes, that's a great question, and I think as moms it can be overwhelming too because we're like, okay, I have to get my steps, I have to take my minerals, I have to do this, I have to take these supplements, I have to see functional medicine, I have a million things I have to do if I want to feel good. The foundational things are the most important things. I will say stress is first and foremost, and moms are stressed. That is just part of motherhood, that stress does come along with it. So finding help, asking for help, and not being afraid to take a little bit of time to step away and do a meditation, a breathing exercise. Even if it's 5 minutes per day, find 5 minutes per day that you can get help and that you can regulate your body's stress response, because that's going to set the stage for everything else. For me, walking is tremendous for my stress response, and that's something you can do with your baby. I think that's tremendous. Protecting your sleep as much as you can. My children are not good sleepers, so I do my best in that area. And just what you put into your body. Like those foundations, if you start your day with minerals and like half a lemon squeezed in your water and a little sea salt and really get your adrenals cranking, those foundations are the things that are gonna be the most reparative to your system. All of the rest is extra, but if you can really fit those foundational things and make them a part of your life, I think they're the biggest game changers.
Any other questions?
You just said minerals, so this is pretty specific, but what do you like? What brand? I don't know anything about that, so.
I am a huge advocate, and maybe you guys have some suggestions too. I love Quinta minerals. They're like a liquid ocean-derived mineral. Basically, the seawater has the same like mineral ratio that our blood plasma does. So when you filter that out and you dilute it down, it is basically like a 1-to-1 replacement for your body. There's some incredible studies on Quinta minerals, and they are my elixir of life. Like if I wake up exhausted from a night of poor sleep, minerals and sunshine, and I'm like, all right, I'm good to go.
I use trace minerals, the drops, you can put the drops in your water, but I agree with you. There's nothing like sunshine and lightning and thunder and rainstorms and all the negative ions that can recharge your body. We're surrounded with positive ions every single day and every single way. The laptops, the phones, everything. And even, like when you step outside during a rainstorm, it just tends to clear everything away from you and it'll leave you feeling refreshed.
What was the first minerals? Keton?
Keton, Quinton. You can get them in little packets. I like the glass jar because it just lasts longer.
I had a question because I have 2 people in my life that have iron deficiency. And I know ferritin is like a huge part of that. But I'm wondering, like, with what you do, would that help somebody who's in that stage right now that is being told that the only answer is a hysterectomy?
So heavy bleeding?
Yeah, heavy bleeding started after her first transfusion, because she had a 6 ferritin.
Wow, okay.
Yeah.
So is she bleeding because she has a submucosal fibroid? Does she have polyps? Does she have adenomyosis?
I think she has cysts. My sister, on the other hand, was going through this for years, and every time she got her cycle was super heavy. She did end up having a hysterectomy last year. Okay. And so she's now on the other side of it, but for the life of me, I'm like, that's not the root. So I'm trying to educate myself because I guess it hit close to home.
Yeah, that's okay. So ferritin also comes along with thyroid dysfunction. Thyroid dysfunction can also cause heavy bleeding. So that's one facet. The other facet is pathology in the uterus. If the pathology in the uterus is causing menorrhagia, heavy bleeding, that needs to be rectified because that's going to be ongoing. So we could do things like uterine artery embolization or ablation of the endometrial cavity to help with the bleeding so that that part is taken care of. But ferritin is the iron storing. That's the storage of the iron. I always say let food be the medicine. There isn't really the greatest supplements to help improve upon ferritin. I mean, you can improve upon iron, but let the food be your medicine. And so I always say red meat because you get heme iron from red meat. That helps to build up the iron storage. But really, the pathology in the uterus needs to be taken care of first. I've seen women that have blood transfusions and lose that hemoglobin immediately just because they're taking it in and they're bleeding it right out. Taking it in, bleeding. They get iron infusions, and even the most extreme cases, there needs to be some sort of permanent cessation of that loss. Does that help? Okay.
Can I add one thing to that? Because you talking about the red meat made me think of this. The gut dysbiosis too, right? Because if you have a leaky gut and you're not absorbing what you're taking in nutrient-wise, or you have gut bacteria that's competing with your body's ability to store iron, like those are some really significant things. So I think that, yeah.
It's all connected, right? Everything is connected.
All right, so thank you very much. I think I took something from each one of you. This question may be for Dr. Jennifer, but I'd love to hear everyone's opinion. Somebody who is at the early stages of possibly having endometriosis, what would be your guidance on, where should somebody start when you're Googling your symptoms, they're consistent with this, going through like the medical system or going through more of like a functional medicine? What's your, what would be a big place to start with all that?
So depending on symptoms and what the cycle is looking like, if there is an inability to conceive, if there's a wish to conceive, I would start with an MRI. Most providers won't order that because they don't want to get the insurance to cover it. But it is a worthwhile place to start to see if there's any deep infiltrating adhesions present, and then to go into a diagnostic laparoscopy, because that's the only true way to diagnose endo. We can do an endometrial biopsy to see if there's BLC7 present in the endometrium that suggests that there could be endometriosis, but I think the MRI is where I would start, and then if there's any kind of pathology showing up there, even endometriomas on the ovaries, that's a suggestive pathology that there's a more aggressive endometriosis going on, but getting to the right surgeon then to do the diagnostic laparoscopy.
Always having microphone trouble. And then I would say after all that's all great information. And then from the musculoskeletal nervous system side, like pelvic floor PTs are huge in treating and in helping with endometriosis. Now we're not going to get rid of the endometriosis, but we can help a lot with the function of just your quality of life, because a lot of those clients and patients have a lot of the symptoms I just talked about, constipation issues or bowel issues, possible, pelvic pain, whether it's vaginally or just in the abdomen, urinary issues, whether that's frequency, urgency, things of that sort. So from our perspective, what we can do for endometriosis is help the tissues move a little bit better, which will help increase blood flow to the area, whether that's internally in your pelvic floor muscles and or surrounding the area like your hips, your abdomen, get you breathing and moving a little bit better, because that's going to just help support everything overall and your ability to just go about daily life. A lot of nervous system regulation, I think, is another big one for pelvic health, but also for endometriosis, because your body's just in a chronic, fighting state here, whether you're in pain or have symptoms of some sort. So getting that to really calm down can also help to improve overall, how the muscles are being able to let go.
One more thing to add, when going in for a diagnostic laparoscopy, it's important to know that your surgeon does excision surgery as opposed to using the laser to ablate the endometrial adhesions. Excision is very fertility protective, and there aren't very many of those specialized surgeons. So just to make sure that whoever you're discussing with us here today gets to the right person.
Is that how Dr. Miller treats I know you mentioned him. Yeah.
Charles Miller does excision, and so does his partner, Christine Sasaki.
Yeah, from our perspective then, after both of the things that these ladies said, which are great advice, on our end, it's always control the inflammation as much as possible. And so that comes down to that cellular health. And I always say, whether I'm treating autoimmune disease or endometriosis or anything under the sun, I'm bringing it back to the cell. Does the cell have the right nutrients? Does it have the right signaling? That's where minerals come in. Does it have the right protection around it? That's where fatty acids come in. And all of those lifestyle things that can help bring down our inflammation. I think red light therapy too is a really great tool for managing and decreasing inflammation with endo.
Yes to red light.
Any other questions? All right, and since I know we're already over, since that seems to be my trend, this will be our last question.
This question is for Dr. Mercier. A lot of pregnant women who have C-sections, they have that scar tissue. How long after their C-section can they come see you to help with the scarring?
Excellent question. So, 8 weeks. Given that the scar tissue or the scar is completely approximated and healed, any kind of gaping or looking infected kind of area, I won't work. But if it's approximated, we start to work, because you think about the lower uterine segment has been incised and now it's laying directly against the bladder, and you want to minimize the invasiveness of C-section scar tissue as much as possible so that you can allow organ mobility and blood flow throughout the pelvis. Real quick as a side, I do see primary C-section scar tissue causing secondary fertility challenges, just so you know. So if you've had a section, it's great to start working 8 weeks. And really we want to get to before 5 months postpartum.
And I'll add to that question just because I think the next progression is, Jana, can you answer when you should be seen after a C-section?
I would say about the same. I mean, I'm like working on similar things where I'm just getting the tissues to move a little bit better, around the abdominal wall, which that's the over to the pelvic floor. So I would say about the same as well. And there's a lot we can do even around that C-section early on, when we're not doing mobilization or anything over it. Even working like into the rib cage area, like some pounding or around borders lower or to the hips, can also help that scar move better quickly earlier.
Awesome. Well, thank you all. This has been amazing and so informative. You guys give them an amazing hand.